The recently passed healthcare law is harmful to American citizens. It needs to be repealed. What's wrong with the new law? The new law adds more of the worst features of the existing system. Republicans and other self-professed conservatives argue against the new law on the basis that healthcare services are currently provided in a free market setting. Government already pays for over half of healthcare services. Government provides multiple advantages to the healthcare industry. We have nothing even close to a free market healthcare system. Democrats, other than James Quillian, unapologetically support socialized medicine. Republicans favor government management of the healthcare industry. The websites of Republican senators and representatives offer a variety of suggestions as to how government can help citizens gain access to health insurance and offer other central planning ideas. What Republicans and Democrats, other than James Quillian, are calling health insurance is nothing of the kind. True health insurance would no more cover a routine doctor's office visit than an auto insurance policy would cover an oil change. What is called health insurance today is a payment management system that adds 33% to the cost of services. Voters have convinced themselves that health care is a right. Because health care is popularly perceived as a right, people have learned to expect free services and pretend that someone else is paying. Misguided thinking about health care among voters and their elected leaders is actually reducing the amount of health care available. Misguided thinking also causes an unfair distribution of services being offered. Popular thinking about health care is keeping prices as high as possible. Only free market forces can improve our country's healthcare system. The best way to make sure all citizens have the most health care possible is to completely remove government from the health care picture. Remove government from health care? That's close to impossible to do in a society where citizens have lost the courage to live as free people. I do have two suggestions. The first suggestion would introduce competitive pricing into the system we have now. A simple way would be to reduce the income tax on physicians for income that is received in cash. On an introductory basis, income tax rates as low as 0% could be offered to doctors on income received in cash. Soon, doctors and clinics would start charging less to cash patients. The second suggestion would replace all government involvement in paying for health care, except for writing off some balances out of mercy. Issue plastic medical charge cards to anyone with a Social Security number. The cards could be used to pay for health care services and prescription drugs. Card users would be responsible for paying the bill in the same way a revolving charge card is paid. The government would guarantee payment to physicians. Unpaid balances would be collected by the IRS. Under this system, a normal monthly bill would be far less than a monthly health insurance premium. To handle extreme cases, it would be possible to set a maximum monthly payment based on income. Healthcare prices will drop rapidly. Both providers and consumers will have incentives to economize. With our current system, only consumers are concerned with cost. The key to improving healthcare is to introduce free market influences into the system.